Hey guys, this is Luke. Today we're going to be showing you how to insert an indwelling catheter on a male patient.
First, place your equipment on a stable surface within reach. Adjust the environment for convenience and lighting. Assist the client into a position that accounts for the physical limitations in performing the catheterization. Apply clean gloves and perform perineal care. Perform hand hygiene. Use sterile technique to prepare equipment and apply sterile gloves. Retract the foreskin if uncircumcised with non-dominant hand when ready to clean. Cleanse the meatus with sterile technique using a circular motion. Repeat at least 3 times using 1 cotton swab or cotton ball each time. Using the dominant hand, firmly hold the lubricated catheter approximately 3 to 4 inches. Insert the catheter.
Take a deep breath and blow it out. 3, 2, 1.
Hold the penis upward with non-dominant hand using slight tension. Gently insert the catheter. Once urine is noted, advance all the way to the bifurcation. Holding the catheter securely with non-dominant hand, inflate the catheter balloon. Gently pull back on the catheter until resistance is felt. Secure catheter with securement device. Collect any specimens needed once device is secured. Hi, today we're going to be walking you through straight cathing and removing the catheter from a female patient.
Okay, first we're going to perform hand hygiene. We're going to ensure that the equipment is on a stable surface and within reach. Adjust the environment as needed, the patient and the patient's bed. Next, we will apply clean gloves and perform perineal care if needed. Good. Using sterile technique, we will prepare our equipment. Now we are ready to go ahead and clean. Using your non-dominant hand, separate the labia and expose the meatus. Next, we will clean the labia and urinary meatus with sterile antiseptic, using only one cotton swab for each area cleaned. Next, we will grab our catheter and prepare for catheterization.
Okay, ma'am, take a deep breath for me.
Slowly advance the catheter until urine appears in the tubing. Allow the bladder to empty into the collection device. Once the bladder is empty, remove catheter using a smooth motion.
Okay, another deep breath, ma'am.
After removal, discard of these supplies appropriately. perform perineal care as needed on the patient, and then perform hand hygiene.
The ATI accepted practice and indications for indwelling urinary catheter insertion and removal are urinary retention, inability to void, accurate output tracking, and they always require a provider's order. ATI evidence-based practice requires nurses to use sterile technique, use indwelling catheters for short-term use, and to remove these catheters ASAP to prevent COTIs. Some key considerations are to maintain the closed system, secure the catheter, and ensure appropriate and thorough perineal care. Some documentation tips are to document the size, the amount of fluid used to inflate the balloon, urinary output, and patient tolerance. The ATI accepted practice and indication for intermittent catheterization is bladder emptying. ATI evidence-based practice shows that these catheters are a one-time use only, and they also have a lower infection risk compared to indwelling catheterization. Some key considerations are to use sterile technique and remove immediately after insertion and drainage of the urine. Documentation tips are to document the urine output and quality and the frequency of intermittent catheterizations.